Visual action therapy is a type of treatment designed by Nancy Helms, Estabrooks, Patricia M. Fitzpatrick, and Barbara Barresi. This type of treatment is a hierarchically organized nonverbal program designed to train people with severely restricted verbal or written expression, specifically patients with global aphasia. This helps them produce symbolic gestures as a form of communication. This treatment is designed to reduce apraxia, increase ability to gesturally represent common objects from memory, generalize skills to everyday settings, and pantomime complex events. For this treatment technique, all of the directions and reinforcements are given non-verbally. This therapy is a structured hierarchical program broken down into 3 phases, 3 levels, and 12 steps. This program uses 5 objects, so a perfect score is a 5.0. Level 1 includes steps 1 through 12 and uses real objects, pictures of the objects, and action pictures. Level 2 includes steps 6 through 12 with no real objects and only action pictures. And level 3 includes steps 6 through 12 where only pictures are used. For scoring, a perfect score is 5. To move on to the next step, the patient must earn an overall score of 4.5. For scoring, 1 point means fully correct performance without prolonged hesitation. 0.5 points is a notably delayed or self-corrected performance, and 0 points is for any other attempt. For the first step, the clinician is going to place the pictures of the object on the table in random order. She'll hand each object to the client and then silently indicate the client to place the object on top of the picture they represent. For the second part, the client is going to place the pictures on the objects. She's going to place the object on the table in random order, and the clinician will hand each picture of the object to the client. The client will then put the picture on top of the object they represent. For this step, the clinician is going to hold up the pictures, and then the client has to point to the objects. This step, the clinician is going to hold up the objects, and the patient is going to point to the pictures. The client places one object at a time in front of the client. The client must pick up the object laying on the table in front of them. Next, the client must demonstrate the object's functional use without assistance in order to receive credit for the task. For step 6, the clinician places the object and an action object picture in front of the client. The clinician points to the picture, picks up the object, and demonstrates the use of the object. This item is not scored since it's just a demonstration. For this step, the clinician will place all the objects on the table in front of the client. The clinician will hold up an action picture to the client, and the client has to do the corresponding action of the object represented in the picture. For step 8, the clinician will place each object on the table slightly away from the client. The clinician will pantomime each object's function after pointing to the object. This item is not scored because it is a demonstration. For the sake of time, the non-scored items were not recorded. For this step, the clinician will pantomime the gesture, and the client will point to the object corresponding to the clinician's pantomime. For this step, for the pantomime gesture production, the clinician will show the object to the client. The client will produce the correct gesture without touching the object. After the clinician removes the object, the client must continue to gesture the object that was shown. For this step, the clinician places two objects on the table in front of the client. The client must pantomime the objects before hiding them under a box. The clinician removes one object from the box and gestures the function of the remaining hidden object while pointing to the box. The item is not scored since it's a demonstration. For this demonstration, the clinician places two objects on the table in front of the client. The clinician instructs the client to pantomime the objects before hiding them under the box. After 6 seconds, the clinician removes one object from the box and indicates that the client should gesture the function of the remaining hidden object while pointing to the box.